So they all present a little bit different, but sometimes it can be hard to tell. So, a couple of things. Number one, some are caused by viruses, some are caused by bacteria. So, strep throat is the one that's caused by a bacteria. And that one typically is going to present a little bit differently. So, usually with strep throat, you're going to have a pretty quick onset of symptoms. And the classic presentation of strep throat is going to be fever, sore throat, headache, maybe stomach ache, maybe vomiting. Usually strep in and of itself does not cause cough, runny nose. So that's sort of the classic picture. And the only way to make a diagnosis of strep throat is to do a throat swab and either do a rapid strep test in the office or to do a strep culture, which can take a day or two. Now, the problem is that, as we're going to discuss, right, there's so much respiratory illness viruses that kids are co-infected with. Plus, living in Ohio, allergy season is rampant this time of year too. So it is possible, and many of the kids that I see present with classic strep symptoms, but also have cough, runny nose, and sort of allergy or cold symptoms. So you have to sort of think about that. So often, if I see a child that pretty much has fever, I'm probably going to swab them for strep throat because I can fix that, right? If you have strep, I can treat you with an antibiotic, and within 24 hours, you're going to be feeling better. Now, we're having this huge, almost sort of triple demic of these respiratory viruses. So the ones we're seeing right now are RSV, or respiratory syncytial virus. We're seeing influenza, both A and B, and then there's still COVID-19 in the community. And we'll talk about those in a second, but there are also lots of other viruses that cause respiratory symptoms, like the common cold, which actually is a coronavirus. It's just not, COVID-19, and obviously much, less symptoms. And we're still dealing with some allergy symptoms. So typically when we're thinking about allergies, you're going to have the classic sneezing, runny nose, maybe itchy, clear, watery eyes, and no fever. And that's really the hallmark of sort of differentiating allergies from these other respiratory viruses, is no fever. When we start to get into fever, is a hallmark of pretty much all of the respiratory viruses that I mentioned. And there's some differentiation between how kids present, but ultimately, the only way to know for sure is to do some testing. But I'm going to talk about why that isn't necessarily, something that has to be done, because unfortunately, for the most part, there is no treatment for these viruses. So let's start with RSV, or respiratory syncytial virus. RSV usually affects younger kids. So typically under the age of 2 is when we see sort of RSV infections, and it causes fever. It can cause runny nose, nasal congestion, cough. The biggest thing with RSV that as the infection progresses, it causes an increase in production of mucus in the small airways of the lungs. And babies and younger kids will often present with wheezing. They almost sound like they have asthma. And that is probably the hallmark of what differentiates RSV from other viruses. And that clinical picture is called bronchiolitis. And there are many different viruses that can cause bronchiolitis. But again, RSV is sort of the prototypical one that causes that. Normally, we see RSV season beginning in mid to late October, and it can run through as late as April. We've been seeing RSV for a few months now. And in fact, even before this year, in the summer of 2021, we were seeing a lot of RSV, which, I've been in practice 24 years, and that was the first time I had ever seen bronchiolitis that early. Obviously, premature babies, young infants, babies with congenital heart disease are at most risk of not only RSV, complications from RSV, but the other respiratory viruses that we're going to talk about in a minute. There is no treatment for RSV, unfortunately, and it's really symptomatic treatment. So it's, the two things I always talk about with families, regardless of which respiratory virus we're talking about, is your baby or your child having any trouble breathing, and are they dehydrated? So dehydration is a little bit easier, right? Are they drinking? Are they having at least 3 wet diapers a day? One of the hallmarks with RSV bronchiolitis is that babies tend to breathe very fast. They can breathe as fast as 80 times a minute. And so we have to look at how much trouble is your baby having to breathe, because eventually two things happen when a young baby is breathing very fast at 80 times a minute. That takes a lot of energy. And ultimately, over days of this infection, sort of the baby's your baby can sort of tire out and and can't keep up trying to breathe 80 times a minute, and their oxygen levels will begin to dip. And unfortunately, in some cases, especially with premature babies or other underlying conditions, babies can get very sick and need to be on a ventilator to help them breathe while the infection is running its course. I mentioned that many babies with RSV bronchiolitis will wheeze, and that's because of sort of this increase in mucus in the small airways. And because of that, that's a different mechanism of how children with asthma wheeze. And so typically medicines that we use for children with asthma, like albuterol, don't work for babies with bronchiolitis. It's doing saline drops and nasal suction to make sure, trying to get a lot of that congestion. If as an adult you get RSV, which some people have not gotten RSV when they were younger, most people will sort of relate it to the worst cold they've ever had. It's just a lot of congestion. These babies are very noisy up in their nose. They have a lot of phlegm, a lot of snot, for lack of a better term, and they can really make a lot of wheezing sounds when they breathe.